My talk is titled The Health Issues of Asylum Seekers, but for those of us that work in immigrant health or global health, we realize that these talks are rarely about tuberculosis or hepatitis or all of the other illnesses we think and associate with refugees or immigrants. These talks often end up being about geopolitical issues, legal processes, psychosocial events, and so my talk will kind of follow suit with that. What I'm hoping to do is cover a couple of different topics. I always like to start by just clarifying terminology. I think everybody in this room comes at this with kind of a breadth of knowledge or at least an interest in the issue, so these terms may be very obvious to you all, but I want to just review some of the terminology, talk about asylum overall, speak more specifically about the asylum process in the United States, focus a bit specifically on the health issues of asylum seekers, and give a little more information about the issues of political torture. And then I want to spend the end of the talk talking about detention in the US and some of the health consequences of that. So we'll start with some of these terms. When we talk about forced migration and human beings that have to leave their home, understanding how some of these terms get used is important when you're reading literature put out by the UN or other international agencies, and even newspaper reporting. So for people that have been displaced and have not had to cross a national boundary, they're often referred to as internally displaced people, or IDPs. And then it gets more complicated with the term refugee/asylum seeker. And so a refugee is any person who's been forced to leave their country, so has crossed a national border in order to escape war, persecution, natural disaster. However, the term is often also used in a more official way and more as a legal definition, especially when it has to do with US immigration. So I'll talk about that in a bit. An asylum seeker is also kind of a category of refugee, in that asylum seekers are people who have had to leave their home country. The difference when we talk about legal categories, so in terms of actual definition, they're both refugees. They've had to flee a national border, cross a national border to flee some type of persecution. But the legal term for a refugee is applied in the US for somebody who has been granted a legally protected status of refugee before arriving in the United States. They arrive with a lot of assistance, or some assistance. That's arguable how much assistance, and I'll talk a little more about that. Whereas an asylum seeker, in terms of the legal aspect, is somebody who's left their country and arrived in another country without any kind of legal protection. Once they arrive in that country, they then apply for legal protection. So it's a much more precarious legal state in terms of documentation and the bureaucracy around it. Asylee is a term that is used to describe people who have applied for asylum and have been granted asylum. They're often also called refugees. Their legal benefits in the US are very similar between asylees and refugees. So in terms of global statistics, I think we're all well aware of sort of the forced migration crisis going on in the world now, but it's really, as far as recorded history, unprecedented and thought to be the largest forced migrant population ever recorded. There are about 60 million people who have been forcibly displaced in the world, and those were the global statistics reported in 2015. I haven't seen any updated statistic, but I can only imagine that it's risen. Globally, 1 in every 22 human beings is either now a refugee, internally displaced, or seeking asylum in another country. The biggest source of these numbers is really the crisis in Syria. I think despite the overwhelming news coverage about Syria, it's easy to think of Syria as a small country far off, but the number of displaced people is enormous. There have been 12 million people, 12 million Syrians displaced. About 6 million of them are internally displaced, so still living within Syria. Another 6 million have crossed that national border and are living outside of Syria and have varying degrees of protected status. We have spent a lot of time in the US talking about how many Syrians we should allow in. To date, we've resettled about 16,000 Syrians with the Refugee Resettlement Program. There are 6 million Syrians living outside of Syria, 3 million living in Turkey, about 1.5 million or 2 million in Jordan, another million in Lebanon, and then another million that have moved their way into Europe. Many have tried to find their way to Germany or Sweden. And so the 16,000 number is really inconsequential when we look at the million that are applying for some type of legal status in Europe, or the neighboring countries of Jordan, Lebanon, and Turkey, who don't have the financial resources of the US, but are really bearing the burden of this horrific humanitarian crisis. This slide, it's a little bit of a busy slide, but I put it in because I wanted to show, let's see if I can work my, just that when you look at Europe, you look at the surrounding countries, and the migrant crisis in Europe, basically a wave of asylum seekers, is not just from Syria. There has been a huge wave, and I'm not really sure what factors have played into the massive increase in migration from Africa, but it's really just an easy boat ride away, much easier journey than the journey from Syria into Europe. And so this migrant crisis has really triggered a political crisis, was largely responsible for the Brexit vote and some of the politics that we're hearing in France and Germany. But the biggest bubble, Syria. So I really want to spend some time talking about asylum in the US. I think we're all familiar with the term asylum seeker, but I think a lot of times there are misunderstandings about what that experience is like for asylum seekers in the US and what that actually means. So this is a very busy slide. Fear not, I won't read it to you, but I wanted to just give a snapshot of what it means, and then we'll also go through the process by which asylum seekers end up in the US and go into more details about their experience. But basically, being granted asylum in the US is an immigration benefit that allows some foreign nationals who have come and applied to remain in the US lawfully. And so essentially they're applying for a refugee type status after already arriving in the US. If someone is granted asylum, they're on the same path that legal refugees are on. They can apply for a green card a year later. The application has to be filed within a year of arriving. Now, there are ways that a good attorney can work around that, but if you, in general, haven't applied within a year of arriving, you try to apply, you could be deported. And a lot of the grounds for being granted asylum are very similar to what we see with refugee status. So in a nutshell, and I won't go into this in too much detail because there are lots of legal hairs and that can be split and pathways that a good attorney can take. But in general, an asylum seeker has to prove a well-founded fear of persecution based on one or more of the following grounds. So race, religion, nationality, membership in a particular social group. And we, over at my organization, Program for Torture Victims, have seen just a massive wave of asylum seekers fleeing countries with a lot of LGBTQ persecution. Political opinion, and now there is an expansion of categories. So there is some protected status for survivors of domestic violence in certain situations, gang violence, female genital cutting or mutilation. The main thing is that you have to prove a well-founded fear of persecution, and this is a very difficult thing to prove. So a good attorney will sit down and find all sorts of kind of external evidence to make your claim. So that may be country experts who report on the conditions and verify that your story coming out of your own country is correct. That may be newspaper clippings of whatever you say that you suffered. Maybe it was reported in your local newspaper. It may be medical or psychological corroboration, which I'll talk about in a little more detail. The Convention Against Torture is another pathway to asylum, and it sort of works along with the well-founded fear of persecution for people who can prove that they experienced torture, and we'll go over that definition in a little more detail. That often provides kind of supporting evidence that they're at high risk for suffering that in the future as well. So this is a chart that I've used at other talks, and I really like it. It's put out by Human Rights First, which is a great human rights organization really focused on the legal issues facing immigrants, particularly refugees and asylum seekers. They're based in New York, and they've just opened sort of a pilot office here in Los Angeles, which is very exciting, and it's been really great, I think, for the immigrant community. But this chart really looks at how refugees get to the US, and I just want to talk about some of these pathways because it'll apply to later on in the talk when I want to discuss more the issue of immigrant detention. So you see with pathway A, this is the refugee resettlement process that I was talking about. Somebody makes a claim from either a second country, a refugee camp. They've already left the country where they were suffering persecution. They go through, if they end up getting resettled in the US, a lengthy vetting process, 2 to 3 years, with multiple interviews with State Department officials and a lot of vetting in other ways as well. They're granted refugee status, and then the US State Department resettles them by contracting out or forming partnerships with local resettlement agencies in the cities that are designated for refugee resettlement. So in Los Angeles, that's International Rescue Committee, Jewish Family Services, Catholic Community Services. There are a number of other small nonprofits or national nonprofits that provide the refugee resettlement services, which involve cash assistance, helping applicants make those claims for cash assistance, finding apartments, job training, ESL classes, et cetera. The other three are really the paths that asylum seekers take. And so the first path here is what's called affirmative asylum process. This is where this is the experience we see in a lot of our clients over at PTV. So these are folks that need to leave their country. Maybe they have enough time or financial resources to actually plan an escape or an exit. They apply for a business visa, a conference visa, a student visa. They apply to a local college in the US, they get an acceptance letter, they're able to get a visa. They travel here legally or with documentation, and then before they've even overstayed their visa, they put in an asylum application and then explain really the experience that they went through. So that's affirmative, and that puts you in a lot less jeopardy of facing immigrant detention, which we'll get to in a moment. The next two, so here we have what's called, let's just, jump down to C, arriving asylum seekers. These are asylum seekers who either deliberately plan to present to the border, so they will travel from all over the world and often enter countries that are easier to get into. If you're coming from a country that maybe doesn't have a great relationship with the US and it's not so easy to get a business visa, a tourist visa, a conference visa, or whatever, or you need to get out in a different way, you can often arrive in a country in Central America or South America and literally make your way up through that pathway and then present to US border officials at the US-Mexico border. For that process, and I'm going to talk about that in a little more detail, it involves having to prove that you have a credible fear. And we'll talk about that in more detail, but you're at high risk of spending some, if not extensive, time in an immigrant detention center. So asylum seekers in the US, so refugees, not asylum seekers, but just refugees who arrive legally with refugee status, the US resettles about 70,000 a year. Under President Obama, he had, so this is decided usually in January by presidential decree. The president gets to set the refugee quotas. The president will usually say about how many the US plans to accept and from which regions of the country will be of the world will be favored. Usually we end up resettling quite a bit less than we've declared that we'll resettle. So 70,000 came in, I think, after Obama had declared that we would resettle 100,000. Under President Trump, he already plans to markedly diminish that number and really expand the vetting process. The numbers we're hearing are that he plans to resettle about 50,000 a year, and the thoughts are that significantly less will be resettled. In terms of asylum seekers, so again, that's different than the legal refugees, about 100,000 applications are filed a year, and about 24,000 people a year are granted asylum. So the asylum accept rate is about 30%, and that varies depending on the category and country which you're applying. So all to say that your chances of gaining asylum are low. They're less than a 50-50 chance. Now, there are ways to make your asylum application more successful. Asylum seekers in Los Angeles, so each city, I think, in each region of the US tends to have a different composition of asylum seekers. I will say, this is an important point to make, that Los Angeles is the home to the second largest number of asylum applicants or asylum seekers after New York City. Or the New York area produces about 22% of all the US asylum applications. Los Angeles produces about 18% of the asylum applications. And the most common claims coming from Los Angeles-based asylum seekers: unaccompanied children, gang violence in Central America, political torture, LGBTQ persecution, female genital mutilation. Los Angeles asylum seekers skew slightly different than the US population, and they also skew slightly different than our subset that we see at Program for Torture Victims. So when you look at Los Angeles asylum seekers, all comers, the most common countries are listed here in order of the number of applicants produced. And so that may not be what you expected. I want to spend a little bit of time talking about political torture just because a significant portion of my work life has to do with working with torture survivors. So it's a subset of protected category for people applying for asylum, but about 40% of asylum seekers have suffered political torture. I want to spend a few minutes talking about it because I think even within the realm of immigrant health, we often think of torture as sort of it's a marginalized issue. I think it makes us uncomfortable to think about it. And it's often, I think there's often a misassumption that it's not as prevalent as it actually is. So torture is a term that is thrown around colloquially all the time. But in terms of it as a legal issue, the most common definition comes from the United Nations. And what it really involves, you need to have several elements to constitute political torture. It's the severe pain or suffering, physical or mental, that's intentionally inflicted by an agent of the state acting in an official capacity. So an off-duty military officer, an off-duty police officer abuse, that doesn't constitute torture. So there are several aspects of somebody's claim that needs to exist for them to qualify under Convention Against Torture and even for rehabilitation services. I always like to make this clear because we've had a recent election where torture was sort of seen as one of many, many things on a platter of possible, international strategies or options for how to deal with immigrants. The reality is that torture is currently against United States law, and it also is against international treaties that the US has signed, and it is a global health problem. It's practiced in over 150 countries. And this is the information that I feel like it's really important to convey. There have been a couple of good studies. As you can imagine, it isn't easy to study this issue, but there have been a couple of interesting studies that look at how common is political torture in just immigrant communities in general, and it really is a significant issue. A study done by Dr. Sandra Crosby at the Boston Center for Refugee Health and Human Rights, great study. She actually looked at all foreign-born patients who presented to an ambulatory health center and found that 11% of them had suffered political torture. There was another study done at a community health center here in Los Angeles, Clinica Romero, by Dr. David Eisenman, who I think is at UCLA now. And he did a similar study in that he surveyed just all comers in the waiting room and discovered that 6.6% of the patients presenting to that clinic had reported a history of political torture. The estimates are anywhere from 5 to 30% of refugees have suffered torture, and as I said, about 40% of asylum seekers have experienced torture. I want to just say, as I was talking, the demographics vary depending on what your subset is. So at Program for Torture Victims, these are people who have reached out to us or been referred to us by an attorney. So they're a subset of help-seeking torture survivors. Our most common countries of origin right now are Uganda, Cameroon, India, Sikhs suffering religious persecution. We're seeing a rise in cases from Nigeria with Boko Haram-related issues. We still are getting cases from Afghanistan, Syria, Iran, Bangladesh, and many, many, many other countries, but this happens to be the convergence of clients we're seeing at this point. And asylum seekers, so in contrast to other immigrant communities in Los Angeles who maybe have moved for economic reasons, or maybe have traveled without having to travel extensively, but have just moved up through Central America, are able to get here and be impoverished, have been impoverished, and come here for economic opportunities. Many asylum seekers can't get here unless they have access to some financial backup. So, it takes money to buy an airplane ticket from Kenya, Bangladesh, etc. Many pay coyotes, many pay bribes to get out of their country. And so political torture survivors who are asylum seekers in Los Angeles tend to skew towards slightly more educated and having come from middle class backgrounds in their home countries. Most of them tend to have been political activists. So maybe they're filmmakers, they're doctors, they're lawyers, they're student activists, they're LGBT activists, they work for a human rights AIDS group, etc. So they're a very heterogeneous group of people, and I like to just flash a few pictures of our clients. This is actually a farmer from Nigeria. This is a teacher from Russia. This is a head of school and his family from Uganda. This is a filmmaker from Turkey, I believe. Torture methods, I'm not going to go into a lot of detail. I think often when you hear the term torture, you can start to feel kind of a fear of what's going to come next. I'm not going to go into any extreme detail, but I like to say that while there are some very common and perverse torture techniques that are practiced around the world, the most common experience for torture survivors is that they were beaten, that they suffered psychological abuse, they were forced to witness other atrocities. However, the others are listed. I do want to just point out Falanga here is a term that you may hear frequently. It has to do, and there are different ways of saying this word depending on what country you're talking about, but has to do with beating of the soles of the feet. It's a very popular form of torture because it tends not to leave any scars. And then I like to mention submarino, which is an immersion in sort of toxic or nasty substances, extremely humiliating and terrifying. So I'll whiz through these pictures. Where torture is practiced, a lot of it is low-level, awful abuse happening in local police stations around the world. But there are governments that have really systematized methods of torture. And you can imagine what this is for. This is actually US soldiers, Abu Ghraib. Awful picture. This is the immediate aftermath of Falanga. So this will heal and not leave a scar, but can often leave the sufferer with chronic foot pain. This is a demonstration, not the real thing, in England of waterboarding. And this is a picture of cigarette burns, another common form of torture, but it leaves a very, very distinct scar. So when we're documenting this for legal purposes, it can actually be, as terrible as it is, really helpful for somebody's asylum claim. So life of an asylum seeker in the US, I just like to bring home a couple of realities that when somebody comes to the US and applies for asylum, they are giving up everything. They're giving up their family, their friends, their professional identity. They're also not allowed to ever go back to their country again. There are ways around that legally, but it's really, really risky for people that end up getting granted asylum who maybe want to return home for a funeral. Their asylum can be revoked, and it's revoked all the time. It's legally really devastating. For asylum seekers, even those that come to the US with some resources, maybe they're middle class, Not being able to work or support yourself, you quickly go through savings and become impoverished. Many of our clients arrive and are staying with friends and have enough money to survive for a couple of months, but then end up in homeless shelters or living on the streets or living in churches. Most asylum seekers do not have legal representation. The majority of cases are filed on their own. Those with legal representation have a much higher rate of being granted asylum. But after somebody's submitted their asylum application, they're actually legally able to get a work permit after about 6 months, get a social security number, and as soon as they submit their asylum application, they actually qualify for full scope Medi-Cal under the Affordable Care Act. So we'll see what happens with that. But I think these are some of the benefits that a lot of people are unaware of, and so it is a special status that you're granted once you apply for asylum. It's the US government's way of saying we recognize that you've applied for protection, you are entitled to some benefits while the adjudication process takes hold. That process now, because of massive backlogs, has extended out to 3 to 5 years, so it's a long process. There are ways to expedite cases, but it's not common. I'll just make a brief mention of forensic asylum exams. So this is the initiative that the medical students, including Anish over there, have pushed to get started at the USC School of Medicine. Forensic asylum exams are a way of physicians or psychologists to provide as objective evidence as they can that some type of harm has taken place. So for physicians who are working with sort of the physical aspects of somebody's claim, we're really looking for evidence of scars. Now, many forms of even physical torture don't leave scars, but if somebody has scars, and these can be documented in a formal way based on international standards, such as a document called the Istanbul Protocol, writing up a report with photographs and drawing some conclusions about these scars and how consistent they are with a report of torture or female genital cutting, etc. Hugely helpful to an asylum case. Having a report like this can make you 9 times more likely to win asylum. So it's really a life-saving measure. And so hats off to the medical students that have pushed USC to get this initiative started. Most common health issues. So this is where I'm not going to spend a lot of time talking specifically about the health issues. You can imagine, having gone through a lot of this, that you're going to see mental health issues in asylum seekers: insomnia, depression, anxiety, chronic pain, somatic symptoms. There are illnesses, depending on where somebody's come from, that have to do with maybe coming from a resource-poor country. Sexually transmitted infections are common. About 40% of asylum seekers have experienced some type of sexual assault. There are specific torture-related health issues, dental issues, lack of healthcare maintenance, and then the journey itself, incredibly dangerous. I'll also make mention that there are some studies. I don't know, are any of you familiar with the ACEs study? It's a study that's gotten a lot of press over the last decade that really looks at the impact of adverse events in children, trauma in children, and the later development of chronic diseases. We're seeing that in some small studies on torture survivors, that those that experience torture maybe in their 20s or as a teenager are much more likely 20, 30 years later to develop hypertension, coronary artery disease, and other chronic diseases. I like to just make mention of this notion of the triple trauma paradigm, which is just a way to remind yourself that, you know, it's often easy to work with a refugee or an asylum seeker or even an immigrant and say, you went through something terrible in your country and here you are, you must be feeling so much better. But there's really 3 steps to the trauma. There's the pre-flight trauma, whatever happened to force somebody to leave. The flight itself, and there are lots of variations on this, but the flight itself can be incredibly dangerous. And then resettlement itself, even in a country like the United States, really, really stressful in terms of language and fear and poverty, all sorts of really difficult issues. So the journey to safety, as I mentioned, this journey is not always easy. Refugee camps, and it varies, but there are high rates of sexual assault and violence. I think we've all seen the horrific photos of drownings of people taking boats to try to enter Europe. 40%, this is a broad estimate, but about 40% suffer rape and or assault on the journey through Mexico to the US border. I think for most of us in Los Angeles, we have some information about what that journey through Mexico is like. Victims of the beast, many migrants, and these are children coming from Honduras, El Salvador, travel along the tops of these freight trains. It's not just that that itself is horrifically dangerous, but there are all sorts of people ready to exploit people as they make stops. So there are high rates of rape and sexual assault and abuse and kidnapping. It's a horrific journey. And there are some organizations doing some amazing work, not only on the US-Mexico border, but all through Mexico. I actually met some folks from MSF based in Spain who have come over to work throughout Mexico and have set up about 8 to 10 way stations along the migrant route just to provide some immediate medical care and assistance. So I want to segue into the issue of detention. So we're going to go back to that category of what we call arriving asylum seekers. These are people that present to the border and request asylum. So there's a process called expedited removal, which means that you present to the border and you undergo something called a credible fear interview. That's where an asylum officer spends a little bit of time with you and you have that's your opportunity to recite your story and basically prove to them that you have a credible claim for asylum. If you pass that interview, you get sent to an immigrant detention center where you could be held there for anywhere from 2 months to a year, depending on what legal pathway ends up opening up to you. And it's a little bit random, and there aren't great statistics on immigrant detention. So I'll talk a little more about that. If you don't pass the credible fear interview, you get immediately deported. So US immigrant detention really grew in the 1990s. Started in the 80s, but 1990s, and it became sort of move legally to solve immigration issues, war on drugs, et cetera, with mandatory detention, limited opportunities for parole. And once that started happening, it really meshed with kind of the industrial corporate prison system. And I think that's where we've run into a problem. Under President Obama, there had been a lot of talk about diminishing US immigrant detention. He did make some great initiatives. He really improved the quality and standards of detention centers and was working to eliminate privatization, which I'll get to in a little bit, and really increase the number of people that get parole. Now, oddly, despite a lot of that rhetoric and some very real initiatives, family detention grew under President Obama, and immigrant deportations, as we know, really expanded under President Obama. So there are about 34,000 beds for immigrant detainees. About 500,000 immigrants are detained a year. It costs about $125 a day. And we have a detention budget which is due to explode, but at this point is at about $4 billion, $3.5 billion. There are a little over 200 facilities in the US that provide immigrant detention. 62% of those are privately owned and run. So you can see where we might be running into a problem. Under the new administration, there has been a lot of talk about changes. I think that what we're seeing is rhetoric as a way to provide deterrence, and I have to say it's actually working, which is frightening because I think it gives incentive for the rhetoric and possible action to increase. But changes that have already occurred, directives have been given to those who do credible fear interviews on the border to raise their threshold for allowing someone to meet the credible fear much higher. So there's a much greater already immediate deportation rate. There's been a limitation on parole, and there are further executive orders and policy declarations that will come. The other big thing is that there is a massive planned expansion of detention and a privatization of that. So after Donald Trump won the election, GEO, which is one of the private jail facilities that has sort of a monopoly on immigrant detention centers, the stock went up by 20%. GEO Corporation actually just signed, I think within the last couple of months, a $100 million 10-year contract with US Immigration to expand another 1,000 beds for immigrant detention. There's also been threats, I think, that we've all been hearing about of increased family detention and separation of parents from children at the border. There are some reports that show that that alone has really dropped the number of families or parents with children presenting at the border, which I think doesn't bode well for future rhetoric and policy decisions. Family detention. I'm just going to show these images. There really isn't much that needs to be said. So I want to make clear that in immigrant detention centers, there's a portion of those that are housed there that maybe have some criminal issues, but a large majority are people with a bureaucratic or paperwork issue. They're asylum seekers, moving through a process. And so you can already see that these are really prison-like facilities. So this is a child watching television. There are two massive family detention centers in Texas that are both undergoing renovation and expansion. So family detention is set to increase. And so again, a lot of these studies really state the obvious, but there was a great study done by Dr. Alan Keller at NYU Bellevue, published this in The Lancet, and not a lot has changed. There are many white papers that sort of support this. But it's very hard to do studies on people detained because you have to deal with all sorts of legal hoops to get access to subjects for your study. So he conducted 70 interviews in detention centers in New York, New Jersey, Pennsylvania, and no surprise, high rates of depression, anxiety, PTSD correlated with the length of detention, and there were marked reductions after release. Human Rights Watch published an assessment of health conditions in detention centers this past summer, thought subpar care, excess deaths, misuse of isolation for people with mental health issues, limited medical care. Is detention an issue in Southern California? Absolutely. In fact, there is one detention center that we have clients we've worked with that actually has reasonable conditions. It's in Santa Ana. It's part of the Santa Ana jail system. And unfortunately, they're closing down in May, which is really going to limit access to attorneys because the next closest detention center is out past Victorville. Adelanto is the name. Adelanto is owned by the Geo Corporation, and we did a site visit on Adelanto along with Human Rights First a few years ago, which I'll tell you about, but I just want to show you a few pictures. It's far out there. It took us 2 hours to get there. It absolutely looks like a prison facility. That's the surrounding. There it is again. This is actually the solitary confinement area, so the open wards don't look quite as horrific as this. But for people that are having issues with a roommate or the general population, the solution is that they get put in solitary confinement. They wear prison garb. And so I just want to tell you a bit about our site visit. We actually did 3 focus groups and then got a tour of the facility, and they have quite a PR machine. We were met by incredibly articulate representatives of GEO who had a spotless and immaculate facility, took us all around, seemingly gave us access to anything we wanted. And then we sat with the focus groups, and it took a long time for Human Rights First to get legal access to these focus groups. In the course of, first of all, the tour, which is amazing, we were there at 11 o'clock in the late morning. I'd say half of the people that we saw were under their blankets, in their bed, in their small unit, not doing anything. And in terms of activities, so the space was immaculate. There were a few TVs suspended from the ceiling. There was one out on the high desert exercise area surrounded by concrete, and the open wards surrounded sort of a dining room. So you were really in one area every day, day in and day out. You had no access to internet. There was access to a LexisNexis computer. And I just want to say there's no requirement of legal representation for people in immigrant detention or asylum seekers at large. Very limited information on the process, because guess what? GEO has a massive financial incentive to have as many people locked up in immigrant detention as possible for as long as possible. We had, in addition to complaints of lack of legal representation and access to legal services and information on the process, like how long am I going to be here, what happens next, People complained, every single person complained about being freezing cold, especially at night, and not being given enough blankets. I'm talking 60 people told us that same thing over and over again. And it was chilly in there, and even during the day, people were wearing 2 of those orange jumpsuits and under 2 blankets in their bed. Lack of activities, inadequate medical care. It wasn't horrific. You go and look at it, you're like, okay, this isn't so bad, but when you drill down, you realize it's a prison experience, it's horrific. So what are the alternatives? I mean, there are reasons to have security issues and concerns about people crossing national borders. But there have been some pilot studies that look at other options to detention that are actually quite a bit cheaper. So offering legal representation really is a way of providing some vetting and helping somebody put together a cohesive case. But paroling, it's already should be on the host of things open legally to asylum seekers or people in immigrant detention, but there's been a very low rate of paroling people. And again, that means GEO isn't getting their $124 per person per bed. There are bonds, so people can pay thousands of dollars and get a bond. That actually isn't offered all that much. Home visits, check-ins with ICE offices, telephonic monitoring, and then even ankle bracelets, although what GEO's doing is renting them out, so people who are given the option of an ankle bracelet have to pay for it. But that isn't open to many people. So there are options, there are pilot studies that show that security isn't diminished and that these are things we can consider. So I want to have some time for questions. I do want to just say that there are some actions happening in Los Angeles. There's a $10 million legal defense fund for immigrants that's been moving through the mayor's office, although there's a little bit of contention over who should be eligible for that. Ricardo Lara, a state representative, about a year ago put together a bill, Dignity Not Detention, that would have made it illegal for cities and counties in California to contract with private companies for immigrant detention, and that was vetoed by Jerry Brown. USC Law School has a lot of great immigrant rights, legal clinics going on, and as I said, the medical students at USC deserve hats off for wanting to push forward this asylum medicine project, and the emergency medicine department is also putting together some options for immigrants.